My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider. Hi, this is Dr. Frank with My Doctor Said What, available on all major platforms. My YouTube podcast about what your healthcare provider tells you and how to interpret some of that in medical information, wellness information. For diagnosis and treatment, you always want to go to your local healthcare provider. Establish a relationship with your local doctor and dentist and make sure you see them regularly for a long and happy life. So I want to talk today about a couple routine medical tests that are sometimes ignored, that are fairly simple and very important to your health. Studies have shown that those that see their healthcare provider on an annual basis and their dental provider on a semi-annual or annual basis have a much better quality of life and tend to have longer life. So those are easy things to do, and they're not that expensive. Prevention is not that expensive, but cure sometimes is. And the earlier you detect something that changes with your health, the better chance you have of having it to be a minor inconvenience and not a major life change or life-threatening illness. So, first and foremost, the one that people fear the most, starting at 45 years old if you have any family history, and at 50 at the latest, you want to have a colonoscopy. What is a colonoscopy? It's when they put a small tube up your rectum with a camera and look at the condition of your lower colon or bowel. And that's important because colon cancer is one of the leading causes of death in this country, the United States, because of our high-fat, simple carbohydrate diet with excess weight, and that is a very high risk factor, some high risk factors for developing colon cancer. So you need to be screened. Even if you don't have family history, by 50 you need to have a colonoscopy. People fear colonoscopies that have never had one. Coming from someone that's had many, I could tell you, due to family history, you want to take all those horror stories you've heard and put them out of your mind. First of all, the day before, you're going to do some prep, and you're going to have a very limited diet of liquids, clear liquids, and you're going to take a solution, which usually depends on the different preps, but they're going to give you a saline-based laxative like Miralax or something, and you're going to put so many packets of very specific directions in something like Gatorade or something you can tolerate, a clear liquid, and you're going to drink those down during the day. And it's amazing. You'll start that in the morning and won't feel a lot of difference other than getting a little hungry after a decent breakfast, and you will all of a sudden have the urge to go to the bathroom and have a bowel move. And from then on till you go to bed, you will probably have many bowel movements, and most of them will eventually become just liquid. And that's the point, to clean the bowel out so that the camera can get a good, clear picture. Then for the procedure itself, you go in the next morning. It's a quick procedure, less than a half hour. They will prep you, make you wear that wonderful stylish gown, and then you will be rolled in, and you will be put to sleep briefly for a very short period of time. And that is unless you have severe health problems, a very easy and fairly complication-free procedure. You will end up going under the anesthesia, general anesthesia. You will, they will take pictures. They usually give you a couple for your album, which just looks like you wouldn't know the difference between your throat and your bowel if you looked at it, the average person. But if you have any polyps, little pink dots will show up, or bigger pink dots. They'll remove those usually, and because those can become cancer tumors over time, we believe, They're abnormal cell growth, so you want to have those removed, and that only takes a second. You don't feel it. There's no pain afterwards. You may have slight bleeding depending on the size, but usually you wouldn't know that you had it done. Very, very important. And then they'll tell you, depending on what the results were in your family history, whether you need to get them every 5 years or every 10 years. And that is really an important, very easy to do. For most people, it's probably easier than getting your teeth cleaned at the dentist. So less anxiety. So you need to get that all out of your mind and do it. Just do it. Schedule it. People are reluctant to have it, but it's a really important tool. The easier tool, like I said, is visit your dentist regularly. Floss, brush your teeth several times a day, and don't just skim over them, but spend a minute or two. Brushing electric toothbrush is a great idea, something like an Oral-B. If you have real issues with your teeth and gums, you might look at a water pick in addition to that. Gargling hydrogen peroxide will make your breath feel better. It will kill a lot of the bacteria, the bad bacteria in your mouth and gums, and then you will also floss that away, and plaque buildup will stay out of your teeth and your arteries. All good, easy things to do, and seeing your dentist to see if there's going to be any longer term issues. You want to make sure you get on that early so you don't have issues like abscess or jaw issues, cracked teeth, things that will cause some serious pain. You'll want to have during your annual physical with your physician or healthcare provider, your PA or your nurse practitioner. You want to make sure if you have any changes in your hearing or your vision that you definitely have eye and ear exams as you get older. I have an eye exam every year. It's important because at my age you start having issues. I had fantastic vision until I was 2015 till I was 63, and the last few years I've have slight issues with cataracts, as everybody does. Wear your sunglasses. That's the best thing you can do to prevent cataracts, as well as eating right and getting enough sleep. Also, you want to keep your blood pressure down because that can lead to issues with your eye health, as well as any of your small capillaries that will be affected very easily. That's one of the things you want to test. I recommend to everybody that they get a blood pressure monitor. You can get it off of Amazon or go to Walmart or wherever you want to go. They're really cheap and easy. And the automatic ones, you just put the cuff on, it blows itself up, it reads out digitally to you. And you want to do it at different times of the day. And you want to see what those numbers are, and you want to keep them around that 120 to 80. As you get a little older, that may go up to the higher 120s into the mid 180s, but once you get beyond that, your healthcare physician, our physician, will tell you that what the steps you might have to take. Keep your weight down, keep it off your middle for sure, and eat a decent diet, get sleep, and you'll find you won't have any of those issues that become any problems until much, much later in life. You can live a very high quality life if you just do a little preventative care. It's like your car. If you never change the oil, you're going to have an issue. If you don't do these things, you're going to have an issue. For women, I recommend that you definitely do your self-breast exam every month. You feel for lumps, especially in your lymph nodes around your breasts. You want to do those. If you don't know how to do one, they're all over the internet, the instructions. Then you want to make sure if you have any changes in your breast, feeling or visually, lumps, any of that, you want to talk to your healthcare provider right away. You want to have your mammogram as scheduled by your OBGYN on a regular basis. And it doesn't matter if you've had implants or not, you need to have those done. You also need to look at your annual physical. Not only you should be monitoring your blood pressure, but they'll look at things like your blood glucose levels to make sure you're not becoming diabetic. Those things you can change early, but once you have damage, they're very difficult to get a handle on. So you want to, in addition to watching that diet and having healthy exercise and sleep, you want to make sure that annual physical. They'll do other things like CRP. That's your reactive protein, reactive protein, and you want to look at that because it gives you a measure of your overall body inflammation to see if you have too much cortisol or you have some latent inflammation or infection. As you get older, one of the problems you're going to have, and no matter who you are, especially whether you're active or not, is you're going to have some form of osteoarthritis. Your joints just deteriorate with wear and tear and age. And bone health is important. Again, if you're taking a good one-a-day vitamin with minerals that's appropriate, that can help. That's not a substitute for eating correctly, but it will help. Calcium's very important. After menopause for women, it's really, really exceptionally important. But it is for men and women, as well as resistance exercise, drinking milk. Low-fat milk is a great source, and other sources of protein you can look up that also have vitamin D and calcium, because that's a combination of those things, the enzymes, the vitamin D, and the calcium, that promote good bone health. People say, oh, I can take a supplement. No, that's never going to take the place. Supplements supplement. And if your healthcare provider recommends them, then you might want to look into that. Otherwise, you're probably pretty good with your one-a-day vitamin with minerals, calcium supplements for women that are in menopause and other specific issues. And then you want to make sure you have some resistance exercise every day, light dumbbells or whatever, and that or if you do some kind of lifting for work, that will suffice also. But you want to make sure you're doing those things, you keep moving, and you get those tests done to see if you're developing any problems. Liver enzymes, common test in your yearly physical with the blood work, really important, because if you're taking any kind of medication that does what they call first pass through the liver, your liver has to detoxify and metabolize that. So the liver takes a lot of wear and tear. So it's a really good indicator a lot of times if you're having early issues with liver enzymes. You always want to look at that. You'll have urinalysis as well as blood tests that will tell you about your kidney function. You want to make sure you have good kidney function. That's how you're eliminating liquid waste out of your body. Most of the water in your body is recycled. A small amount that contains pathogens as well as chemical that you don't need that could be harmful are going to be excreted through your urine. So again, your kidneys and urinary tract are the workhorse of eliminating bad things from your body. So you need to have a look at that. And if you're excreting excess sugar or you've got other issues, it can show that you're developing something like diabetes, and you can try to get ahead of that instead of having an issue. And for those that are diabetic, some wonderful new technologies. Just want to throw this in there. We've went to the patches and this and that monitor through your smartphone and that, and now we're getting to the point where we're having implants, so you don't have to mess with any of that regulate your blood sugar and your insulin. Then you've got the great promise of stem cells. We found that stem cells with pancreatic cells may re-stimulate your pancreas to produce insulin in a correct amount, and you will be cured literally from diabetes. So I'm thankful for the National Diabetes Association and those that are working hard to come up with a cure for a disease that's really tough. But for those that can prevent it, that have type 2, that are just by becoming obese, and the other issues that are associated with excess weight, the wear and tear in your body, you need to make sure you increase your exercise, get better sleep, change your diet, and do everything you can. Everybody's built a little differently. Genetics controls some of that. Some people have wider shoulders and littler hips, and some have this and that, or ectomorphs or endomorphs or mesomorphs, general categories of your build type. But within that structure that you're given genetically, you need to maximize your weight in that. Make sure you have the proper weight, and your health care provider will help you with that between your BMI and your waist to height issue and those different measures. Some of the things we see that are really important are not only just your BMI and your your waist measurement, but we find that that your lean body mass is really important. That your composition of your actual tissue, the higher the muscle mass versus the lower the fat, is a really good indicator of good health. And there's tests if you want to get into that. That's a little excessive, but if you do, it's a really cool thing to see how you're progressing with exercise. And there's a big payoff. Regardless of your weight, exercise is always important. And with that, the other tests that you need to have on a regular basis is you want, like I said, you have to have eye exams and ear exams on a regular basis. You want to get ahead of that, make sure you're not having issues. Loss of hearing is associated with an increased risk of dementia. So you'll find that you definitely want to take care of your hearing. If you're not wearing hearing protection when you're doing things like mowing the lawn or weed whipping, or any loud noises, even when theaters are too loud, you have some decent earplugs or hearing protection is really the discreet ones. You don't have to wear the big ones depending on what you're doing. You do have to wear ear muffs for certain activities. You want to make sure you protect your ears and protect your eyes with your sunglasses. Make sure that if you need readers or prescription glasses at some point, that you get those. If you're a contact wearer, make sure you take care of making sure those contacts are clean. They're changed at the time, if they're disposable, that you're supposed to change them, so you don't end up, because you're touching your eye. Make sure your hands are clean. Wash your hands on a regular basis, and I mean wash them fairly thoroughly. And don't touch your face, your lips, your eyes, your nose. Those are all mucous membranes that are going to cause infections if you've touched anything that has those pathogens or germs on them. And your eyes in particular, if you're a contact wearer, you want to make sure your hands are clean before you change those contacts, and that the contacts are clean. So those are simple, easy things. Last but not least, I want to talk about products that you need or don't need. You know, it's funny, shampoos, you can use, there's a million different shampoos, literally, almost on the market. And all of them do basically the same thing, and a lot of money spent on advertising. But if you find one that's compatible with the amount of oil you have in your hair, or lack of, depending if you have a dry scalp or oiler scalp, find ones that work. And you may find in seasons that those change a little bit. Find the ones that work, that don't have harmful ingredients in it, and you can find a list of those online in several places. Find those, and the major brands usually are pretty well screened. Those companies like Procter & Gamble do a lot, or Unilever or Colgate do a lot of work in toxicity to make sure that you're not exposed to things that are harmful. But do a little reading on your own and find ones that work for you. Same way with skincare products. It's important to hydrate well, because that's going to keep your skin and hair moist and hydrated. And you're also going to want to use, if you have dry skin or as you get older, for sure, some moisturizer. After you're out of the shower and that, use it doesn't have to be a high-end product, but a decent skin moisturizer. Gets good reviews, doesn't have toxic chemicals in it, and make sure you moisturize your skin, and you'll be surprised how many problems that alleviates, where you don't have to worry about developing eczema or different things like that. So these are just simple everyday tips. Staying hydrated is really important. Protecting your eyes and ears, really important. You know, I see people out in the sun all the time without sunglasses or sunscreen, and I just don't understand that. You're literally changing the cell structure of your eyes and your skin and opening yourself up to some really serious disease. Your eyesight's pretty important, and your skin is the barrier between you and the outside world. And if it's compromised in any way, it's really a problem. That's why if you get cuts, bruises, any kind of thing, you want to make sure they're cleaned out immediately with soap and water. Depending on a cut, you may have to use hydrogen peroxide or some alcohol. Need to go to a healthcare provider if they're serious enough, or if you even think they look like they're going to need stitches, because you got to stitch healthy skin, not skin that's dying around the edges because you waited several days to go get it looked at. So with that, this is Dr. Frank on all major platforms. You can find my podcast, and I wish you a wonderful rest of the 23 season, holiday season coming up. Be careful. Don't drink, don't drive and drink. And be careful. Party, have fun, enjoy socialization, but have a great year, and let's have a great 2024. Thank you, and have a good day. Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.